I'm here outside the Queen Elizabeth Hospital in Kings Lynn in North Norfolk. This hospital is currently in special measures after failing in key aspects in 2 recent inspections. This puts this hospital in the danger zone when it comes to options for closure. It will no doubt be a key target for Jeremy Hunt, the Secretary of State for Health. Jeremy Hunt is trying to sneak through a law which will give him the power to quickly close any local hospital without listening to local people. No hospital is safe. This particular hospital, the Queen Elizabeth Hospital, Kings Lynn in Norfolk, is a case in point. QEH has seen once routine procedures now being dealt with at the Norfolk and Norwich Hospital, as well as path services for blood testing being transferred there. This has had the effect of restricting access to results by staff at the hospital as well as GPs, inevitably delaying diagnosis. Bit by bit, this local hospital is having its core services hived off. This naturally leads to a reduction in its functions and makes it vulnerable to losing its district general hospital status. Once this happens, it will lose its A&E totally. It's come to light the GPs are being advised not to send patients through A&E, to refer them directly to departments. This leads to lower footfall and yet another excuse to withdraw the A&E function because it will be deemed to be unnecessary. Alongside this is the already understaffed, full-to-capacity maternity unit, which has on several occasions recently had to close its doors to mothers in labour, forcing them to travel to other regional units at Peterborough or into Lincolnshire and Boston Hospital, adding at best an hour-long car journey. This isn't scaremongering, it's factual, it's happening now, and unless the Kings Lynn community stands up and takes action, they'll find themselves with a cottage hospital and having to travel to Norwich or Peterborough to get treatment. This would potentially be an 80-mile round trip for patients and visiting relatives. Imagine the costs involved in that. Not only that, but those without personal transport would be forced onto a poor and underfunded public transport system. A transport system which doesn't even include a direct rail service to Norwich, which is the nearest major city to Kings Lynn. What if you have to visit a loved one every day and have to use your car or the dilapidated bus and rail system? Think of the time and financial impact on already stretched personal budgets. It's also worth remembering that both Norwich and Peterborough are PFI hospitals with huge debts. Forcing us to travel and use them will see them get extra income to pay their private investors. Jeremy Hunt is changing the rules after losing twice in court trying to close Lewisham Hospital against the wishes of local people, doctors and nurses. The sweeping new law, the hospital closure clause of the care bill, will give the government the power to shut down any hospital in as little as 40 days, regardless of how well the hospital is performing. It could be as little as 1 week before MPs vote this sinister threat into reality. This quote is from The Guardian. Clause 118 of the care bill threatens hospitals with downsizing or closure. Public outcry saved Lewisham Hospital. Now the government wants to change the law to ensure that it can reconfigure hospital provision as it so desires. It's going to be tough to stop Jeremy Hunt, but if enough of us are keen and there are possibilities for next steps, raising awareness of the actual impact on our communities is only the first step. It'll then be down to communities and not just interested individuals to take action to save hospitals. And if Hunt gets his way, they'll have to work fast to save their hospitals, and various forms of direct and indirect actions may be required. A study of NHS Foundation trusts in England has found the number of those in financial trouble has nearly doubled in a year from 21 to 39. Jeremy Hunt has shown before he's willing to close good hospitals to bail out ones which are struggling. This law would allow him to do this, even if local patients and doctors were strongly against it. Shadow Health Secretary Andy Burnham said after a decade of improvements in cancer waiting times, progress has been derailed by David Cameron's NHS reorganisation. You have to take action now to protect your hospital, or will you wait until the 40-day countdown starts? Alan Taylor-Shearer, Queen Elizabeth Hospital in Kings Lynn.